Hey, it's Josh at Prescription Fitness Physical Therapy here in Geneva, New York. Just bringing you a tip of the day. This one for low back pain. So, oftentimes when we experience low back pain, the natural tendency is that we want to go ahead and stretch this out again. Previous videos that I've done, a lot of times in our spine, what seems to be the logical thing to do, which is stretch it because it feels tight, maybe is the wrong thing to do. So, very often, because of the way we're built anatomically, most of our back injuries occur by bending forward. We're lifting, repetitive bending, lifting, sustained posturing, poor body habitus, poor posturing, things like that at work. So let's say I woke up and I'm having some back pain. Now this exercise is applicable mostly for pain that does not referral of pain, anything that extends further than, let's say, the top of the buttocks, anything down into the legs. This exercise may not be applicable, so just be careful. Always use common sense. If it seems like it's making your symptoms worse, you may want to sort of modify it or just stop and get better guidance and counseling. Maybe go see your physical therapist right away and get an initial evaluation. So let's say I woke up and I'm experiencing central low back pain. So I have pain dead center of the back, or maybe I have pain off to the side. A simple exercise that I can do, I can take my hands like this, bring my feet wider than my shoulders. So I bring my feet wider than my shoulders and grab a hold of my waistband. So I like to do it that way simply because when you grab a hold of the waistband, you can use your knuckles kind of as your fulcrum point. And what I'm going to do is I'm just going to lean backwards. I'm going to go into where I feel pressure. I might feel some pulling in the anterior chain or maybe into my hip. So we're going to go pressure on and then pressure off and pressure on and pressure off. And what I'll do is I'll repeat that exercise. I'll do that maybe several sets of 10 repetitions. What we should see if the exercise is working is that maybe it gets a little bit easier to perform the movement, and when I get done doing it, maybe the symptoms are a little bit better. If the pain seems like it's going towards the center and it's intensifying, keep going. So that's what we call a centralization effect. So keep going with that. Try to go a little bit further. So each time, if you can go a little bit further into the motion and the net result is that I feel better, keep doing it. It's a great tip. If it doesn't work, if it seems like it's making your symptoms worse or causing your symptoms to peripheralize, which means going down into your buttocks or further into the leg, you're going to stop that. And again, if you need to see consult, go see your physical therapist. Physical therapists, this is what we do. So see us at Prescription Fitness Physical Therapy and Sports Care here in Geneva.